Today we're going to discuss meniscus tears, and I'm going to give you some of my favorite meniscus tear exercises so you can strengthen and rehab your meniscus tear. So, meniscal problems of the knee are relatively common. You may experience pain, clunking, locking, swelling, and weakness of your knee if you have a problem with your meniscus. Once the meniscus is damaged, generally meniscus is unable to heal. However, there are new advanced and non-invasive treatments like cold laser therapy that can heal a meniscus significantly faster. Now, a meniscus injury does not necessarily require surgical intervention. Many people with a meniscal tear do very well using conservative treatments. Meniscus damage can occur with repetitive use over time, such as in those that run a lot or hike, or someone that uses their knees regularly in their job. Sudden trauma to the knee can also cause meniscal damage. For example, twisting the knee during a sporting tackle or a fall can certainly provoke a meniscus tear injury. The knee is a hinge joint. Being in the middle point of your lower limb, it is required to take some considerable forces. The meniscus are two crescent-shaped springy pads made of cartilage that sit on top of your shin bone or tibia and act as shock absorbers. So damage to your menisci can range from a very small nick to a large tear. The impact, which can lead to difficulties moving your knee, locking of the knee, pain and or swelling. Now, rehabilitation focuses on strengthening the muscles surrounding your knee in order to offload the stresses and strains placed on your meniscus. We'll get into my favorite meniscus knee exercises in just a second. Always avoid activities that will provoke your symptoms. It may be necessary to stop some of these for a period of time while you build your strength and control in your muscles. Cycling is a great way to substitute for other sports as it strengthens your muscles without running the risk of twisting your knee or placing heavy loads throughout your knee. There may be persistent swelling as a consequence of the damage. This can stiffen your knee. Place some ice, wrap it in a damp towel on your knee for no longer than 20 minutes. It's important to check your skin periodically so that you don't cause an ice burn. Try to establish other ways of performing strenuous activities. For example, instead of carrying a heavy load once, break it up into 2 loads and carry 2 loads or 2 batches. Avoid deep squatting if this is something that irritates your symptoms especially. Now, before I introduce exercises for a meniscus tear, I want to make sure you understand that it's vital that you improve the strength and control of your muscles supporting your knee. This reduces any further irritation to your meniscus and helps to settle the symptoms you currently have. These exercises I'm about to introduce may focus on other areas of your body, including your hips, your trunk, and ankles. If pain persists, I suggest seeking professional help. If you have any questions or comments, feel free to comment below. And of course, if you got anything out of this video, please give us a thumbs up, like, and subscribe to see our 4 weekly videos. And thanks again for tuning in. We appreciate you. Stay healthy.
Lie on your side with your legs straight. Place your top foot in front of your bottom foot on the floor. Lift yourself up on your side using the lower arm with the hand on the floor. Your hips will come up off the floor until your body is a straight line from your head to your feet. Lift your upper arm directly up so that it is in a vertical position. Maintaining control with your body, lift your top leg up and down. Do not allow your body to sink or wobble too much. Relax and repeat. Lie on your front with your toes on the floor. Place your forearms on the floor and push up, lifting your torso and legs. Hold a straight line from your shoulders to your feet for as long as you can, preventing the back from sagging. Keep your buttocks squeezed and your hips level. Holding this alignment, try to raise one straight leg off the floor. Hold, then lower and repeat with the other leg. Lie on your back with your legs straight and feet, lower legs supported on an exercise ball. Squeeze your buttocks and lift your pelvis so that your body is in a straight line. Hold the position of your trunk and roll the ball towards your buttocks by bending your knees. In a controlled manner, let your knees straighten while keeping your hips straight. Note: keep your hips straight and back in neutral position. Stand in front of a step. Step up onto the step, then step back to the starting position. Continue the step-ups and let your arms swing by your sides. Stand upright on a step, facing down. Step one leg down off the step, followed by the other. Return to the step and repeat. Start by standing with your feet hip-width apart with an exercise band loop around both feet. Squat down with one leg and at the same time slide the other leg sideways, keeping the knee straight and toes on the floor. Maintain hip-knee-foot alignment in the standing leg. In a controlled manner, return to the starting position. Start by standing with a band secured around to one ankle or foot and attached low to the same side. Have a sliding disc under the same foot. With the other leg, squat down and let the band pull the other leg sideways, while keeping the knee straight. Push back up and pull the straight leg back towards midline against the resistance from the band. Start by standing on one leg on a balance pad. Squat down and with the other leg reach as far as possible in each of the following directions, just touching the floor with minimal pressure, and then return to the start position. Straight forwards, anterolateral. Forwards and away from the midline. Sideways, posterolateral. Backwards and away from the midline. Straight back, back and behind the standing leg. Maintain hip-knee-toes alignment in the supporting leg throughout the exercise. Stand tall with feet slightly wider than hip-width apart. Toes pointing forward or turned a few degrees outwards. Keep your chest up and your spine and neck in a neutral position. Squat down by sitting back and bring your arms forward. Push back up through the heels, chest up, and straighten your hips. Note: keep your hips, knees and toes aligned and don't let your lower back round. Keep your weight evenly on your whole foot.